The excimer laser basically uses a gas to create an ultraviolet laser beam. The ultraviolet laser beam is very tightly controlled, both in terms of the energy and the location to which it's delivered. And what it does is it's like the Star Trek phaser. It vaporizes things. It actually takes solid material and it turns it into a gas. So by actually pointing the laser where we want, we can remove tissue to reshape the front surface of the eye, the cornea. At London Eye Centre, we use the STAR VISX S4 IR laser. God, it's a lot of letters to toss in there, but that's the latest version of the excimer laser made by the company VISX. And that is our laser of choice for a couple of reasons. The first reason is it minimizes how much tissue is removed. So there's only what you're born with in terms of thick corneal tissue is what you have to use for your entire life. And so the less tissue we can remove to do a correction, the more you have there to structurally keep the cornea stable, and the more you have there so that if we need to retreat later on, we can do that safely. So that's the biggest advantage we find with it. The second is that, like all of the latest generation lasers, it tracks the movement of your eye. So it allows us to deliver onto the surface of the eye exactly the shape that we want, even if you move your eyes around a little bit, even if there's some little changes that we can't plan for. So it allows you to carve onto the surface of the front of the eye exactly what you want in terms of what you've planned. With a nearsighted eye, what you want to do is you want to make it concave. You want to actually flatten out the center of the cornea. And so what the laser does is it removes more tissue in the center and then less as you get out to cause a bowl shape in the center. For a far-sighted person, you want to do the opposite of a myopic person, which is you want to steepen the center of the cornea. And we do that by removing a donut of tissue around the center. So in a hyperopic correction, you don't touch the center, but you remove a little groove or a gutter around the center, which effectively steepens the center part of the cornea. For astigmatism, you have to actually remove it's basically like a semicircle of tissue. So it actually removes a band of tissue deeper in the center, thinner at the outside, to get rid of that difference in shape between the two axes of the cornea.